Okay, so this leads to the next session, which is ECH Alliance Network of German Digital Health Ecosystems. Our network of German ecosystems share their regional initiatives on health data and data sharing. For those who've seen our work with previous presidencies, they'll know that one of the things that we've tried to do when we've worked with member states is to create a legacy by opening more ECH Alliance ecosystems. And it's great in that the last 12 months, we've seen a number of new German ecosystems open. And it's clearly Germany is one of the most important digital health markets in the European Union. So without further ado, I'll hand over to Andy Bleeden, who will introduce the next session. Thank you.
Good afternoon and welcome. Welcome back to this next session. My name's Andy Bleeden. I'm the director here at the European Connected Health Alliance, the ECH Alliance, for our ecosystems and membership. This afternoon's sessions gives us a chance to focus down on our ecosystems that we have here within Germany. We have a network of health ecosystems across Germany that we've built up as part of a legacy during the German presidency of the European Council. And today we want to focus in and get you to meet those three ecosystems that we've got now and find out a little bit more about them and their health data initiatives that they're involved with. We've been proud to build up this legacy of a network of ecosystems during the presidency period because we've done this before. During the Finnish presidency, we also developed a network of ecosystems where we've now got 6. And in Germany now, we're proud to have 3, we think, really exciting ecosystems with more to come. But today we're going to focus down on 3 of those from Rhineland and Bonn, from the Erlangen and Nuremberg region, and also from our latest in the Hessen Frankfurt region. But firstly, let's look at what we mean by ecosystems. A lot of people talk about ecosystems, and it seems to be quite a buzzword at the moment. Our ecosystems are somewhat different. They're different because they've been around since 2011, 2012, and we've developed a network of ecosystems across the globe. Our ecosystems are permanent, multi-stakeholder gatherings, which bring together all the stakeholders of health and social care. The main difference with our ecosystems is that they target and focus down on breaking down silos that exist in health and social care. They transform health and social care delivery, so they're not just a talking shop, but also they look to create economic opportunity. All the stakeholders within digital health and social care also includes, as you'll see here, both the patient and the citizen, as well as companies and all the other players that you can see around in the circle that we've got in front of you there. What this means in practice is that we've got a network of ecosystems that collaborate internationally across the globe. And I'll give you some examples of those in a moment. But of course, they're all different. They're all got slightly different national focus, but they all have key underlying principles, which we think are essential as part of our offer of a network of health, digital health ecosystems. They're all based on the geographical area. They're free to attend, which is important. Otherwise, the patients and citizen groups and small companies won't attend, nor voluntary groups. And they're vital to bring in that multi-stakeholder approach. We believe our ecosystems should be light on governance with a working group behind them. But also, most importantly, and this is central, they should lead with a need, because patients and citizens should be at the center. Now, as I said, we have a network of ecosystems. Our network is grown because people within our ecosystem network want to collaborate. I joined one of our first ecosystems when they first set up back in 2011, 2012 in Manchester. But all of our ecosystems want to collaborate. And you can see here the wide variety of ecosystems we've got. We've opened up globally now in countries as diverse as Argentina, all the way across the globe to Australia. We've set up networks of ecosystems. They're all crucially locally focused on a geographical basis, but they're all different. However, what they all share in common with each other is that desire to collaborate and connect and join the dots, as we say in the European Connected Health Alliance. And you can see in front of you the network we've grown now. This year, we will be opening our 50th ecosystem in India, which was very exciting for us, and we're looking forward to announcing this very soon. Our ecosystems exist to collaborate together, and they want to do that because they want to increase access to international markets. They also want to collaborate with other regions because that's what people do. They do that because they want to scale up innovation from their region to other countries, because that helps that local economic growth. But also, our ecosystems recognize the importance of bringing in best practice from outside their country into their region, and they get a chance to join that wider network of ecosystems. So that's a little bit about our ecosystem network. I'm now pleased to welcome the first of our German ecosystems, and it was the first of our German ecosystems from the Rhineland-Bonn region, and I'm pleased to welcome both Alexia and Hans from our ecosystem Rhineland.
Good afternoon. My name is Alexia Zukoin, and I'm very happy to be part of this afternoon's session on regional efforts in Germany when it comes to health data initiatives. I'm part of the Health Region Cologne-Bonn. I'm the managing director of the association's limited firm, as well as the director of the Gevi Institute for Healthcare Studies. And we're here today with you all and with my colleague, Dr. Hans-Peter Dauben. He is chairman of the board of Digital Health Citizens, also a part and member of the ecosystem Rhineland. And he's also professor at the Rheinische Fachhochschule and has already 20 years more experience at the German DIMDI Institute, which is now the BfArM, or part of the BfArM, the Federal Institute for Pharmaceuticals and Medical Devices. For my part, I will start by telling you a bit more about the Health Region Cologne-Bonn and the ecosystem Rhineland in particular. As you can see on the map, it's a joint initiatives in between a number of members here in the region, all around the two cities of Cologne and Bonn, but not limited to those. We are a much bigger and broader geographical area, also going all the way to another land, so not restricted to North Rhine-Westphalia, also going into Rhineland-Pfalz. Our partners and founding members of Ecosystem Rhineland are the Digital Hub Cologne, the Chamber of Commerce Cologne, the Gevi Institute, the Health Region Cologne-Bonn Limited Company, as well as the association Gesundheitsregion Cologne-Bonn, Health Region Cologne-Bonn, and most recent addition, although it's also a year ago, Digital Health Citizens. We are part of a big network, or the other way around. The network is what forms us, and all those topics that are a part of us are coming bottom up. We are obviously focusing on health and anything that contributes to health. We are very strongly looking at healthy aging and integrated care, but we're also looking at electronic health records initiatives, platform, digital health through platform economy, also the social determinants of health, governance of health, personalized health, and you can see all the other buzzwords. We work through our projects that are sometimes EU funded, sometimes Germany funded, at the federal level, or funded from regional funds. And these are three examples that you can see here, Shapes being a Horizon 2020 project, Oberbergversorgt, an Innofond project, and Inge Integrate for Care, a North Rhine-Westphalian project. As I was saying, we're part of or we represent 140 members of the region. And on the next slide, we will also see that these members are spread throughout a great variety of sectors. They come from the medical or technical medical technologies, apologies, from pharmaceutical environment, from health insurance environment. We have startups among our members. We've got big universities, hospitals, and also a great number of smaller initiatives. On the next slide, we can see the breakdown of those members that, as you can see here, quite evenly spread. And so we are very proud of being very heterogeneous. I'm only going to say a couple of words more about that health ecosystems. We see that we are also having public bodies, and we're very proud of that. They are our founding members of the Health Region Cologne Bonn, and this is what guarantees for the ecosystem Rhineland a great connection to policymakers and health decision makers. On the next slide, we have the companies that we represent, also within and outside Germany in our medical technology guide. And we are very proud of having those competencies here in the region. And finally, we have also the advantage of being part of a numerous other networks, such as the European Connected Health Alliance. On the next slide, you can have loads of those examples here. They're both European networks, but also German networks, but very much looking at the European level for connecting, looking for project partners, looking for more exchange and lesson learned all around those topics that are of great interest to us. Thank you very much. And I'm very looking forward to the presentation of my colleague Hans-Peter.
Yeah, good afternoon. Thank you, Alexia, for this introduction. Thank you for giving the chance to show what we are planning to do and what we actually have started. We, Digital Health Citizen, have been founded 1 year ago as a result of some activities around improving the situation for startups. And we have been founded on the experiences of 15 years of talking to industry, how we can bridge in Germany the gap between society, who is a little bit afraid of sharing data, and the needs of associations and companies to get this data. As Alexia already said, we have been started with the in Cologne, starting to work together with a group called Digital Health Germany. This group was implemented to support startups, small, medium enterprises, and to bring them together with investors and big companies. But as we are already connected to Euroscan International, which is a group, an international network on public agencies handling horizon scanning, we had immediately spread to Italy and Spain. So the idea is, how can we bring in people to help us to overcome the burden of sharing data, of sharing all this information which we are in need to improve the evidence according to digital health. We started in Cologne, and we have now members also in Bilbao, which is not the Rhineland, but the main activity we are doing still along the Rhine, starting from Rotterdam, going to Basel, and then bringing people together. We are less focused on specific topics, as you are from the business perspective, as yours with Alexia. What we do is to bring in people, to bring in the citizen. That's why we have the name Digital Health Citizen, so focusing on citizens in the health area. We want to bridge the different interests of these people, and when we founded Digital Health Citizen, it was the aim to show that this is a non-commercial organization. So we are based on German tax rules as non-commercial, non-for-profit organization, just to give the people the chance to store their data, and then they can decide by themselves to give access to what they need, to whomever they want to share the data with. So doing this, we also have the ability to bridge boundaries because in Europe, because of the data protection laws, normally public agencies and the healthcare setting organizations are not allowed to share data across the border. But with the permission of the citizens of Europe, we can do this. And that's why we have the group in Italy and in Spain, where we try to overcome these limitations when the people would like to share this. So it's also then bridging and decreasing the fearness of sharing data, because they still have and see all the time what is needed. And when we discuss it with patients organizations, what is the benefit on the other side, they would like to have that we are more or less a little bit taking over the role of the information services when there is something out in the area where the data have been used, that they got a feedback on what is needed. So this is what we try to bridge, and this is the aim of Digital Health Germany Citizen as well. So what we do is here to set up an ecosystem, and our ecosystem is from the beginning not that we are selling something, so we would like to work together with those who are developing something. So cooperate, participate, and share. The idea and principle is when somebody wants to build a mirror for a car, he normally has not to develop the whole car by himself. So why do startups need to set up their own data protection system, the complete system infrastructure, and to collect people to share their data when there is one single approach which is combining the different approaches within a network. So we don't want to overcome all people to just be with us. We would like to share it and want to disseminate it in different areas, because this is also increasing the data protection. We do this already with some local hospitals in Cologne, where we have shared platforms, but we have also split up the platforms in some areas so that communication can be done in a safe way. So participation of the people, cooperation with those who are offering something, and sharing data when it's needed and only when it's needed to the innovators is very important for those who would like to include in our network. We are missing things, and we are missing the team approach. We do have now a huge amount of groups, of activities, of regional activities. What we see is that the exchange of information between is quite low, that the awareness on specific actions is quite low, and we would like to do something and to help something to make people more aware what's going on. Language is a barrier, and you have heard that I'm not a native speaker, but not only language is a barrier, but also the culture behind the language is also another barrier. So we have to bring people together from different cultures with different languages who can then disseminate within their cultural zone the idea and bring it together. We do not want to collect everything in one place, because this is counterproductive, and it's even increasing the risk for the data. So by this, people can work together on different aspects, and then we can overcome people to share their information. Let me just take into account rare diseases, where we need something like sharing data all over Europe, but also in ultra rare diseases, where we have even via Euroscan requests from Asia, how we can bring these people together on ultra rare diseases. So we need people who would like to help to set up the infrastructure, and then to bring in the academics who can analyze these things, and then the startups and SMEs who would like to develop products on these results. So we invite them to work together. Naturally, because we are non-for-profit, we need also sponsors. But I think if we can achieve this added value, the cost for the system, which is based on open source software and on all these activities, is quite low. And because there is no business plan behind it, it's fine. So it's just that the cost for the system has to be done by the system. And by then, the people who are more intelligent than us, who can invent things and who have the idea about new products and about new services, they can be supported. So from the beginning, our perspective was to support people. So by this, even my light is now going out. I thank you for your participation and looking forward for your questions.
That was very interesting, and certainly good to hear from a very focused approach around health and health data from our ecosystem in Rhineland. Now I'm very, very pleased to welcome our speaker from our Medical Valley ecosystem, who's going to talk about their ecosystem there, and also Benjamin will explain to us some of their healthcare data initiatives.
Okay, hello everybody. My name is Benjamin Stöcklein. I am head of international services at Medical Valley, and I'm doing this since 4 years. So I get used to be an expert more or less in international market access, especially to the German market. I'm an industrial engineer by training, and this is why I'm very open and interested in new innovation anyhow. So that's why I'm very interested to give you some more impressions what we do here at Medical Valley, especially to support digital innovations. So we as an organization have been named National Digital Health Hub in Germany in 2017, which means that Medical Valley is the best spot in Germany to drive digital innovation in the sector of healthcare. So what is Medical Valley? We are an area with 500 medical device technology companies. In our area are 665 hospitals located and a lot of research institutes, so around about 100. And what we do as an association is we drive all the players here in the area together, bundle them together, and try to facilitate them to get new innovations done. So you ask yourself maybe who is in there. So in the first line, we have some of our global players. Some of them you might know, like Siemens Healthineers or Adidas. But we have as well, like in more or less every area in Germany, as well some hidden champions dedicated in special applications. So it's really from digital health to suppliers and dedicated eye surgeon industry, everything along the chain you can imagine. Companies are here and facing new innovations and products into the market. We are running an incubator since 2003. We have incubated a lot of companies, also some of the companies who are seen here right now as SMEs and global players also had been in touch with us before. And here are also some icons of the actual startups who are in our incubator. This is our team. We are around about 15 full-time people working for the team. Each of us has specific background and specific purpose in the support of young companies in the medical industry. And on the right, you can see the names of our board. It is coming from the who is who in our area, from political support to healthcare providers, and from industry and research. All the top seats are here, and they're giving us the political guidelines to run our strategic and operational things. So where do we see ourselves? So all our activities should be guided and should address 4 different stakeholders. Most of our time, we are more or less acting with business actors, researchers and teachers and healthcare providers. But all these activities should lead that citizens will be enriched, especially in their health environment and access to it. So what are we doing for this? We clustered 4 different areas where we think we should be active. The first is training and education. I give you some examples each time of these. So for training and education, we are running different programs. We are engaged in boot camps, or we run in hackathons. Overall goal is that the questions and the problematic things in the innovation of ideas in the healthcare industry should be on a larger scale brought out to different stakeholders. And innovation research, we are active in a lot of consortiums with screening for new projects get funded by different initiatives. always to get new people on a seat, to get together and drive new innovations. As I mentioned before, we are running 2 incubators. So this is one of our main activity lines, is really to support them, to find new infrastructure models, to support companies that more successful spin-offs and startups are rising here in our area. And on our 4th point, the model region Medical Valley, we try to get in touch with as well political stakeholders and others to really get here in best infrastructure to get innovation into the healthcare sector. So today, I want to give you as well some specific outlook and initiatives we are doing at the moment with the specific scope on health data and health sharing. So one initiative I want to share with you today is funded from the Bavarian Ministry, and it's about the so-called DigiDem Bavaria digital platform. What is the aim? The aim is to really monitor dement persons, to give them a long-term data cognitive impairment tool. For this, we try to register the people and problems and give there in the first place a digital register. And on the other hand, we want as well to collect digital offerings, so to strengthen the medical care situation. This is a really highlight project here in Bavaria, and we are running this with different cooperation partners. And one of my colleagues, he is doing all the project management of the whole consortium here. And another project is an internal project, so it's an own funded project from the FAU, from Siemens Healthineers, from us Medical Valley in the University Clinic in Erlangen. It's the so-called DHIP. And in the DHIP, we have different aspects, but there are the 2 highlight aspects are the digital data center and the digital twin. In the end, we can start with the digital twin. The overall goal is, as you might heard, with digital twin, it's not a new word, but overall it should be a virtual assessment of a patient, where his patient, where you make virtual analogies, and with them you can test the different diseases with the person and give him better understanding of the relevances of treatment and understand better how treatments affect this person. And within the DHIP consortium, there are 2 highlight projects right now beginning in operation. The one is breast cancer, and the next is rheumatology. With these, they start with the process. And overall, to run such things, you need a very good detailed databases. And this is the other objective of the DHIP program. Anywhere in the world, it's quite complex to get access to clinical data because you have a lot of problems to overcome. We summarized it here a little bit on the left. It's lacking on the willingness of patient. They need more normally to subscribe. You have data security problems. You need to anonymize the data. Overall, it is a lack of informatics in the medicine, and it's quite complex to get access to this. And so we have here within the consortium the opportunity to get access to clinical data from the university. And it's not only open for the Digital Health Twin project, it is also open for other initiatives. So this is, to sum up, these are more or less the 2 highlight programs at the moment we are running. There are plenty of more, but I only have 10 minutes today. So I just want to give you some insights what we are doing. And this is what we do at Medical Valley. Overall, we are trying to foster here in the area the aspects of health, and we are very open for international collaboration with other people. Thank you very much for your attendance.
Thank you for that, Benjamin. Fantastic to hear what's going on in the Medical Valley ecosystem. Lastly, and by no means least, I'm very proud to welcome, as I said, our newest ecosystem in Germany, the Hess Health for All ecosystem, Health for All Hess, which is run by Natalia. Natalia is going to talk a little about the ecosystem, and then we're also going to hear from Zishan Mahmoud.
I'm Natalia Korchikova-Hip, the coordinator of Health for All ecosystem on digital health solutions in state of Hessen, Germany, and managing director of SDG 17 Consulting GmbH, and also coordinator of working group on digital health solutions within Global Health Hub Germany. Thank you for organizers for invitation and opportunity to present our ecosystem Health for All. I have also with me a prominent member of our community and my colleague, Zishan Mahmoud, who is Director of Strategic Portfolio Management in Avanta, who will be also presenting today on topic digital tools enabling health research and best practices. And I'm happy to introduce Ecosystem Health for All. And I'm Natalia Korchikova-Hip. My company, SDG 17 Consulting GmbH, is working on several pillars: sustainable development goals, sustainable infrastructure, and sustainable innovative solutions for healthcare. Why digital health solutions? Because they are an opportunity to make a leapfrogging for many countries to achieve sustainable, affordable, and accessible healthcare. Digital health solutions, without doubt, our future. The worldwide healthcare is going through the radical transformation. Nowadays, only 30–40% of healthcare is provided within the hospital walls. We are developing new solutions like virtual care, hospitals fully without beds, totally built on telemedicine solutions. And such virtual care hospitals already on the market for 3 years. That's why I think digital health solutions are very important in our work. And talking about sustainability, you know that the world has pledged to achieve sustainable development goals by 2030. And we will not be able to achieve SDG number 3, which is health and well-being, without digital health solutions. But the paradox is that such solutions, which many people would benefit from, actually these people will least likely to be online. And it's very important when we are designing new digital health solutions, we have to also think about how to remove digital age, gender, and income divide. A couple of words about current political context. You know that Germany presides currently in the Council of the European Union, and current priorities of Germany are, of course, combating corona pandemic, but also to support digital health solutions, for instance, responsible and human-centric artificial intelligence for healthcare. Last year, we had a very important development in Germany, the adoption of Digital Healthcare Act, which introduced the applications on prescription. That means that around 73 million insured patients now entitled in Germany to healthcare through digital health applications. Of course, this is the very big push for digital health market. And just to give you impression about the market, I would like to mention that every second smartphone user in Germany already using digital health solutions. And out of 300,000 mobile applications worldwide, 1/3 of them is targeting German-speaking countries. So the market is huge. Let's move now to state of Hessen, where I'm based. You might know Hessen because of Frankfurt am Main, which is the financial capital of Germany. But Hessen is also known for its innovation-driven pharmaceutical, biotechnology, and medical technology and IT sectors. And the Hessian health industry is dynamically growing and generated more than 26 million euro. To be more precise, more than 5% of Hessen IT industry is employed in health IT. It's approximately 5,000 people. Just for comparison, 2 years ago, it was only 500 people. So it's a 10 times rise in 2 years. Very impressive. There are already a large number of innovative e-health solutions in Hessen. In order to present the developments in a clear and systematic way, the government of Hessen has introduced e-health project Atlas, which is being developed as central information and communication platform in Hessen. Furthermore, the government of Hessen is considering to expand this informational platform and to make a full-fledged health portal. Hessen is a home of various related health initiatives, forums, and platforms. Just to name the few: Competence Center for Telemedicine and e-health, House of Pharma, Digital Hesse, House of IT, Gesundheitswirtschaft Rhein-Main, etc., etc. There are many, many others. I just want to mention one platform also developed in Hessen, PPP Health for All, which is a global platform to support public-private partnerships in the healthcare sector. The platform having the members from 20 countries and users from 36 countries. There is a big potential for digital health solutions here, as the international trend is to structure IT and healthcare projects as public-private partnerships. Just to give you an example, for instance, in India, the COVID-19 tracking app was structured as a public-private partnership. And also in the Emirates, Malawi Health Information Exchange Platform was structured as a public-private partnership and now providing solutions to give a response to COVID-19. What is the purpose of Health for All ecosystem? Well, first of all, we are building on the experience of already existing 40 ecosystems within the European Connected Health Alliance. And we also would like to mobilize local stakeholders around the following issues: to map local digital health solutions in Hesse, with focus on solutions which has potential for internalization. Then, of course, to learn about latest developments and innovations in digital health, to identify digital health innovators for potential partnerships, and inform members about current opportunities, call for tenders, competition, policy developments on global, European, and local level. What is our priority? Of course, it's Corona, COVID-19. We are looking for digital solutions that would track and understand the spread of the virus, ensure that the patients would get care they need, and the healthcare workers get essential supplies and information. Who are our members? The specific feature of our approach is that we keep our ecosystem open to all interested stakeholders and not limiting it to the service developers and providers. I think this is our added value, and added value of our ecosystem, that we are connecting the dots and also we promote the local players. Thank you for your attention. Here's my contacts. And now I have a pleasure of inviting to the floor my colleague Zishan Mahmoud, Director of Strategic Portfolio Management at Evanta, and he will present digital tools enabling health research, best practices. Zishan, the floor is yours.
My name is Zishan Mahmoud. I'm responsible for strategic portfolio management at Avantor in the lab supplies area in Europe. And today I'll be talking about digital tools for the scientists in the lab and about digitizing the backbone of healthcare R&D to enable precision medicine. First, a little bit about Avantor. We've been serving the science community for more than a century now. We have around $6 billion in revenue, a Fortune 500 company. We operate in 4 main segments, so biopharma, healthcare, education, and government, and advanced technologies and applied materials. And we have a broad range of around 6 million products touching equipment and instruments, materials and consumables, and services and specialty procurement. Globally, we have 19 ISO certified distribution facilities, 27 manufacturing facilities, and 9 regional innovation centers. So quite a global scale of our operations. We have around 12,000 associates and counting more globally, so that we can meet customer needs and demands as they come. From a portfolio perspective, we're quite diverse. Majority of our portfolio and our sales come from the Americas and Europe, and we're growing in Asia. From a product perspective, we are mainly selling and reselling third-party materials and consumables, but also our own proprietary materials and consumables, equipment, instrumentation, and around 85% of that revenue is reoccurring. From an industry perspective, we are serving around 2/3 of our business is in serving the life sciences. So 65% is in life sciences. You can see here, biopharma, healthcare, education, and government. So this is a little bit about Avantor and sort of where we come from. What makes us a little bit unique is that we really can offer the end-to-end workflow to our customers in terms of offering, in terms of product and service, from discovery stage all the way down to delivery, and in between, of course, development and scale up. So today I'm here to talk about what are some of the best practices and importance in generating ecosystems and partnerships to enable precision health and precision therapies. So I think today's a lot of the talk is about the digital health solutions themselves. I want to come at it from a little bit different angle, a little bit more from the lab space angle, because those are some of the underlying technologies that enable precision therapies. So as you know, the apex of information or data, it's going from data all the way down to insights and wisdom, which can be then used by the scientists in the lab. And these are all very important pieces of the puzzle that have to come together for any therapies or precision therapies or personalized therapies to become real. In the end, you're always looking for insights and wisdom, and along that you have digital tools and content that can really make that happen. So what we really focus on, or the industry really focuses on, is to apply the knowledge into action. Why are we doing something? What's the best thing to do? And really focus on the now and the future on the back of the digital tools. Now, there's a plethora of tools for scientists in all stages of research to manufacturing. The data points are very disparate, they're very different, but they all come towards a similar goal, right? And if you look at it from this perspective in the slide here, you have scientific informatics, you have laboratory informatics, you got formulation design tools, you got data science tools along the way, manufacturing analytics, and they all make up that puzzle. Now, if you want to really succeed in making digital health a real and tangible development, you have to bring together the right pieces and the right information together, right? Because therapies are becoming more personal and more precision, it's going to be always a unique journey for each customer and for each user. So, some of the best practices that we see is that we would like to unleash the full potential of precision and personalized therapies by enabling a seamless journey for the researcher to utilize those digital tools and content in the lab and bring those insights to actual action. So what are some of those best practices? And that's the theme of the call today. First, you have to create the right ecosystems and platforms that connect the various tools and offer the relevant content to empower the researcher and solve pain points. It's nice to have digital tools, it's nice to have content, but if you don't bring it together in the right way, this could obviously hinder your solution, your digital solution, your digital therapy, if you will. You have to also enable the connection between the digital tools and leverage their power towards data-driven decisions. So more and more, it will become a multiple-step approach with multiple data points coming in that enable these data-driven decisions that we really want to give our patients. You would need to also support the procurement and manufacturing organizations by providing the best-in-class products to the researchers and partners. This can be by enhancing predictive purchasing and analytics, enabling equipment and instruments that are, IoT connected, and many other tools in the toolbox and technologies in the toolbox. I think one thing that is very important and sometimes is often missed is you need to keep the user in mind when designing your user experience by understanding the customer journey. Every customer journey is different, and that's fine. You need to also understand when you design your tool and how to make it the best way so that the interaction for the user is smooth and seamless so that they can spend more time on the science, on the breakthroughs. You also need to conduct voice of customers, leverage supplier and partner strategies to actually enable the understanding there. I think we often can get into a rabbit hole of designing tools that are great and they are awesome and they are very techy, but we need to remember what is it that we're trying to solve, why are we trying to solve it, and then the how is equally important, but once we know why and what, we can really come to something tangible. So in summary, as more personalized therapies are enabled on the back of digital data analytical tools like machine learning, pattern recognition, etc., the combination of tools and knowledge will be required for each researcher's journey that will be unique. And that's some of the best practices we should take away when creating digital therapies or precision and personalized therapies. Thank you very much.
Thank you. The original DHS summit was scheduled to be in Berlin before the pandemic, so it seems very appropriate that we should have just listened to a range of German innovations from a number of new Echalliance ecosystems. So that brings us to the break. So please have a quick 10-minute break, and if you can be back at 15:45 CET, thank you.